Do you know how to properly breathe using your diaphragm muscle? Well, if not, this video is for you. There are many benefits to diaphragmatic breathing. The first being proper pacing of your exercise and exercise routine. Number two, diaphragmatic breathing stimulates our parasympathetic nervous system, or more simply, our rest and digest system. This system helps us to obviously rest and digest, but also to heal, slow down and reduce anxiety and depression. Very important for patients who are dealing with a lot of stress. And the third and most important benefit of diaphragm breathing is stimulation of our lymphatic system as a whole. Now, to keep it as simple as possible, all of our lymph comes together in one major vessel within our abdominal cavity. This vessel, also known as our thoracic duct, actually perforates the diaphragm muscle. So as you'll see, when the diaphragm muscle expands and contracts, it creates an almost negative space within our abdominal cavity, and that negative space creates a suction. That suction will also help promote better lymphatic flow through the entire system as a whole and keep our lymph flowing optimally at all times. So let's begin. If you've never performed diaphragm breathing before, I want to make sure that you are either sitting or in a lying down or reclined position. The reason for this, diaphragm breathing changes the way we bring in oxygen. So if you've never done this before, you might feel a little bit lightheaded or dizzy, and that's a completely normal response. Remember, our diaphragm is a muscle, and the more you practice this, the better you will get, and the easier it will become, with less and less symptoms of dizziness. So I'm going to show this in a reclined position. So to begin, I'm going to have you place one hand on your chest and one hand on your belly. Now, our diaphragm is a dome-shaped muscle deep underneath our rib cage. So when I talk about belly movement, as the muscle expands and contracts, you will see the belly actually moving. But please remember, it's the diaphragm causing this motion. It's not our abdominal muscles. No belly dancing, please. So if you perform a few normal breaths, just breathing in and out, it's normal to feel the rise and fall of your chest. This is our lungs filling with air and oxygen, and then as we exhale, releasing that air and oxygen from the lungs. That's perfectly normal, and we want that to continue. But as we perform diaphragm breathing, we want to feel more motion, almost exaggerated motion, coming from our abdominal area. So as you breathe in, you're going to try and bring the air all the way down and really expand that diaphragm muscle, feeling the belly fill with air. So breathe in, and then exhale. Watch as the belly empties of air and the diaphragm goes back to its relaxed positioning. So breathe in, feel the abdominal area expand and fill with air. And exhale. Watch the belly go all the way back down. Now I'm going to perform 3 of these breaths in a row, nice and slow, so you can see what my body is doing. In through the nose, fill the belly with air. Exhale, empty the abdomen of all the air. Now a little bit slower. Last time. Now, if you're feeling dizzy or lightheaded at all, please stay here an extra moment before you get up. For the rest of you, please remember that the more you practice this, the easier it will get. There are many benefits to diaphragm breathing,